12th Annual Legislative Forum, Healthcare Workforce in the IE. Where are we? I'm Allison Elsner, and I'm the CEO of the San Bernardino County Medical Society, and I'm also the chair of the IE-CHI, the Inland Empire Community Health Initiative. And as most of you know, the mission of our coalition is to ensure that all families and residents have access to affordable, quality, and culturally sensitive health care in the Inland Empire, which includes Riverside County and San Bernardino County. You can always find more on the IE-CHI's website at iechi.org.
Allison, you're muted.
Oops, somehow my computer was sending me some sort of message there. It muted me. So anyway, I was trying to encourage everyone to go to the IE-CHI's Facebook page as well, where we have a lot of great announcements about our events and projects. I also want to give a shout out. I probably will embarrass her a little, but I want to give a shout out to our IE-CHI consultant, Victoria Stephan, for all of her incredible work to pull everything together. I always tease Victoria that she drives the IE-CHI train, and she teases back that she just herds the cats, but she's the most overqualified cat herder I have ever seen. So thanks for being our backbone and every other bone as well for us, Victoria. I also want to make sure you all know Tiffany Law, our program manager, who's been with the IE-CHI now for almost a year. I'm sorry, almost a year and a half. And she's such a valued member of the team. So thanks for all your work, Tiffany. If you're on the camera, if you'd give a wave there. I saw you on there, but you may have your camera off. So, all right, a couple of quick notes as we get started. Please be so kind as to keep yourself on mute. And if you have questions, we are going to have those questions asked at the end of all the presentations after everyone has spoken, so we all have they all have a chance to speak. So you can enter those questions in the chat feature on Zoom, and we will probably also have some raise hand time, but that way, as they go along with their presentations, you can enter those in and we'll have those ready to go when it's time. So first up, we have a fun video to share with you, and it's just about 2 minutes. Earlier this week, Victoria and I visited Riverside County Supervisor Manny Perez in his La Quinta office so that we could present him with a special gift and a compilation of well wishes from our board and our advisory board members. And as many of you know, Supervisor Perez was responsible for launching the first IE-CHI Legislative Forum 12 years ago, and he was instrumental in the early progress and advancement of the IE-CHI, especially into the world of advocacy. So let's go ahead and take a look at the video here.
Allison and the chair, and myself and the experts. Because we realized this year when we were planning the 12th annual legislative forum that you started. Wow. When you were on our board and our advisory task force, you brought all your expertise to us and challenged us to take the next leap, and the legislative forum was that. So we never really recognized you do that, and so we're able to do that. So I brought you something.
Well, okay. Well, thank you so much. Look at that. Can I take it out?
Yes, I hope you'll be able to.
All right, here you go. The founder and our hero of the Inland Empire Children's Health Initiative. That's what it was called back then.
It was.
Now what is that? What's the C stand for now?
It's community health.
Community Health Initiative, Legislative Forum since 2012. This is cool. You got my name on it. Well, thank you so much.
And we have one more item to present to you here. Our board, of course, wanted to be a part of this because they appreciate you so very much.
Okay.
And our board has developed this series of messages here.
Oh,
on
wow.
This framed photo here. So I'm going to just tell you who's contributed to that. Well, we have, of course, we always consider Victoria as our honorary everything because she tells the board what to do. But we also have Alex Bravo with Molina Healthcare. We have Dr. Danielle Kilkenstein with the Inland SoCal United Way. We have Lisa Schifano
Program Development Specialist with Riverside County Office of Education. We have Kevin Matheny with Family Assistance, and we have myself, Alice Nelson. So
Wow.
I'll let you read these messages. I want to be sure we can show those here, but I'm just going to tell you what my sentiment is, and that is, you've been and remain a source of inspiration with your passion, purpose, and steadfast guidance for the IHI and IE residents. Because of you, the IHI exists and thrives. What better way to say it than you are the man? So
well,
I'll
thank you.
present that to you.
Oh,
And thank you for everything.
Oh, well, thank you. This is amazing. I never would think anything of this, that this would come my way, Allison, and thank you, Victoria, and obviously, I really appreciate what you're doing. I think it's come a long way. Not only the advocacy work that we're doing now, that you're doing now, and meeting with legislators, which that was an important thing for us to do. But now at the state level, right, you got Mark and they're working on making sure the many and making sure folks that are on Medicaid are gonna get Medicare, and those that are on Medicare are gonna get Medicaid at the same time, right? And so to get that healthcare through the insurance. Back then, ladies and gentlemen, this was an entity that worked very hard to ensure access to healthcare through the insurance programs for children. And then it became for the families. And that was through state funding, and that's because of the advocacy. And so, anything else you'd like to say to that, Victoria?
Well, I'd like to share one other thing. Everybody knows Supervisor's experience in legislation and policy and his commitment to the Coachella Valley, the lower desert, the region, and the state. What they may not know is that he also is very good at busing. And I learned this at a state child resort retreat we did at a youth camp in Lake Tahoe.
Well,
few years
that's
ago.
right.
I don't really remember that.
That's right, we went up there, how many years ago was that?
That I don't know, I looked it up a few years ago, but we had to bus our own tables, and I learned that he was very good
Yeah.
at doing that, so.
My mother taught me well.
She did, and so I want to thank you. It's been an honor working with you and an adventure working with you.
Well, thank you, thanks a lot, sir.
Thank you.
Thank you, Allison, thank you so much.
Thank you so much, Supervisor. We sure do appreciate you, and thanks for getting this started for us.
Well, you didn't have to come out here, they decided to come out here, ladies and gentlemen, I appreciate it, I'm actually stunned by this, taken back. We do this line of work because we love our communities, we love to make sure that people are taken care of, the quality of care, and at the end of the day, it's justice. Not because we're, trying to get tributes and things of that nature, but it's always nice to get what you want to. So just want to say thank you, and let everybody know back there, whenever you see them, once again, and I say,
We sure thank you so much.
if y'all need anything, and any time, just give me a call, not too far away, and now you know where my office is.
And that's right.
Downtown Waukeeta.
That's good, that's good.
Well, hey, I can't see you.
Well, thank you, ladies and gentlemen, and last words?
Just thank you again. You're a star.
Okay, thank you, everybody. Okay.
Okay, that was fun. So thank you to Supervisor Perez for that. And thanks, Victoria. We had fun doing that. So, all right. I would like to now welcome our IHI Board and Advisory Council members, and I want to give a special thanks to the members of the IHI Advocacy Task Force. And I'd like to go ahead and introduce the chair of the Advocacy Task Force, Dr. Danielle Kilshinstein, Danielle, I'm going to get it right. Dr. PH, who is the Executive Director of Government Relations and System Transformation for Inland SoCal United Way. She's been a member of the Advocacy Task Force since its founding. Dr. Danielle is also a member of the IHI Board and appreciates working in partnership with this impactful regional collaborative in pursuit of improved health outcomes for every child and family. Dr. Danielle and her team are responsible for planning and coordinating this entire annual legislative forum. So Dr. Danielle, I'm going to turn things over to you right now.
Thank you so much, Allison, and happy Friday afternoon, everybody. We're very excited to see you today. I just wanted to give an extra shout out to you, Allison, as Executive Director of the San Bernardino County Medical Society. We really appreciate your strong leadership and your thoughtful partnership with the IHI as we travel along this journey together to expanding outcomes for children and families. So just thank you so much, Allison.
Oh,
And as Allison mentioned, the Advocacy Task Force really works in collaboration with all of you and everyone together to provide education and also elevate the priorities for children and families' health issues, not only to the general public, but to elected officials and partners and community members alike. So again, wanting to just thank all of our Advocacy Task Force members and all of you and everyone who works together to make sure that we're successfully moving forward to meet our mission and vision. So very quickly, I wanted to shout out to who the Advocacy Task Force members are. We have Kevin Mahaney from Family Assistance Program, Alex Bravo from Molina, Cindy Sanchez from Chaser, the Community Health Association Inland Southern Region, and Jezebel Urbina from IEHP, the Inland Empire Health Plan. And I know we already gave a shout out to Victoria and Tiffany, but just wanted to also extend the thank you to you as well. So we are very excited for this discussion today with our amazing keynote and panel. And as you know, joining us today is Diana Fox from Reach Out. We also have Senator Ochoa Bogh, Assembly Member Reyes, and Riverside County Board of Supervisors Spiegel joining us today. So in order to just dive right in, I'm going to go ahead and get us started by introducing our keynote speaker, Diana Fox. So Ms. Fox is the Executive Director of Reach Out. It is a nonprofit organization that addresses health equity and drives crucial change through both policy and direct services in the inland Southern California region by breaking barriers to educational achievement, expanding economic opportunities, and creating safe and healthy communities. Ms. Fox has received numerous awards and accolades over her years of service. A few, just to name a few, include being named Executive Director of the Year by Academy Go and received an Outstanding Citizen Award from San Bernardino County Medical Society, among others. And she is a current member of the Health Equity Committee for RUHS, the Riverside University Health System. So please join me in welcoming Ms. Fox, and I would like to turn it over to you.
Thank you so much for that introduction, and I'm going to just take a minute here to get my PowerPoint up. This is such an honor to be invited to speak today, and just can't wait to dig in. And I apologize. I have a ton of data to throw at you, but don't worry. We'll have time just to talk to you, but I'll also put the entire PowerPoint into the chat at the end so that you have that. So don't worry about, trying to capture kind of an avalanche of data and other things that I'll share today. And so let me start by just going through today why I'm here to talk about health workforce. Many of you know that Reach Out has been doing health workforce work since 2007 under the Inland Health Professions Consortium. And what I put up here in the orange of really we're focused on really diversifying our health workforce so that is reflective of our populations here, but also the message of really after you receive your education, please come back and serve here because we need you. And we really want to develop a really strong and responsive health workforce that meets the needs of the Inland Empire. And so I'll dig right in with, I'm going to go over some slides like fairly quickly, and don't worry about it. Again, you'll get all the slides. So we're going to talk a little bit about different, educational things, the skills that people need to be hired for certain jobs, and where our main shortages are, and those types of things. But one of the things I think that's really important for context to know is that we all know that right now we're at about 4.6 million residents here in the IE. Some of the data that I think is really important for all of us to understand is that we'll have another 112,000 residents by 2028.
And Riverside County actually will be adding the most residents of any county in the state by that time. San Bernardino is, I think, fourth, but San Diego County is second, but we're going to ignore them for now. And we'll just take all their health professionals that they'll give us. And so, but I think the other thing over here in this green box that's really important to know is that half of the California population growth will be in the Inland Empire by 2028. We are going to be seeing half of the people are going to be here in the Inland Empire of the population growth. So it's really significant and something to keep in mind, that even as tough as our numbers are right now for a lot of our health professions, they have the potential to get even more difficult in the future. So this chart, you could spend about 2 hours probably looking at this chart and dissecting it, but it's really talking about like where our age categories are. You know, we've kind of got this wave here from the 5-year-olds to the 34-year-olds. And then what it's showing is that where we are now is in the gold, and where we'll be in that age bracket in 2028. So as we really look at, if you go over to like the 65 to 70-year-olds, you're going to see that we're going to increase significantly in that age population. Also, even in the 75 to 84-year-olds, you know, there's an increase as well. So just thinking about how we're preparing our workforce to really serve our older residents is important to consider, as well as that we've got a lot of young folks coming up as well. I'm going to skip this one. It's just kind of some explanations. But, you know, here's what you all, probably most of you who are on this call already know, that 10.3% of the jobs in the Inland Empire are in public or private healthcare settings. That is a very significant number. Right now, we know that our transportation and warehousing is still #1, but we know too that there have been some pullbacks in that area too, just because of the way things have shaken out after the pandemic. But when you think about fully 10% of our residents of our region work in health, it's really another hugely significant number. This is the other thing I want to really share with you as well, kind of laying out again, you know, in a different way, but these green little bars over here are also extremely significant to know that even though retail trade might have a big number of employees, their growth is small over the next 5 years. Whereas if you look at healthcare, we are going to have a significant growth in healthcare of over 15,000, almost 16,000 jobs. And then the other thing I wanted to really point out to all of you is this piece in blue over here on the left, that healthcare employers are expected to contribute 14% of new jobs over the next 5 years. So even though we only account for about 10% of the jobs, 14% of the growth will be in healthcare. Again, just some definitions, going to skip over. So this one is really talking about, you know, we know that our region doesn't have some of the same numbers for higher education completion numbers, right? So we're a little bit lagging in that area, but tons of great work happening in that area. But really looking at where some of the, you know, so if you have a master's degree or up, how many jobs there are, the average hourly rate, whoops, sorry, you guys, I clicked on it by accident. The average hourly rate, if you look at those overall, yeah, this is in healthcare, sorry, is $102.81 an hour in healthcare. Versus if you're in a non-health occupation with an advanced degree, you're at almost half of that amount. So just something to be aware of. If you have a bachelor's degree, this is where the numbers are pretty comparative, whether you're in health or not in health. But there are a significant number of jobs in this section of 48,000 jobs are bachelor's degree jobs in health. And then if you have an associate degree, you know, there's over 56,000 jobs and an average hourly wage of $35.19. And then if you go to the high school diploma area, you'll also see that we have a smaller amount of jobs, but an average hourly of $25.25. So it's kind of, if you think of the jobs in healthcare that only require a high school diploma, you know, they might be working in a hospital, but they might be in different service positions and things like that. So anyway, so something just to consider, you know, as we're working on our education pipeline, just in general, of how much untapped economic investment in our region is sitting out there, you know, with the different wage scales, you know, if you have an advanced degree, to be able to really be able to have a wage that is sustaining your families.
Diana's still talking. We're still not at Karen yet.
So, oh, I'm sorry, I'm not sure if that comment was what that was. Sorry. Okay. So we wanted to just give you a little bit. I can't go over all of the shortage areas today. There just isn't time, but we'll get to that in a minute. So we kind of did a few slides on, yeah, we know there's healthcare worker shortages, but right, the potential retirement in the next 10 years of workers 55 and older. Our dental population has been pretty consistent for a while, but we are coming up to a major retirement zone here for our dentists and orthodontists. Same thing with respiratory therapists and medical record specialists. You can see the high number of retirements that are in the looming. And then we can also look at occupations, kind of cutting it different ways for some equity lens. Majority male employed, paramedics, occupational health and safety, specialists and technicians, and dentists that are primarily male employed and very few female employed. Something to think about when you're doing outreach to make sure that we're being equitable in that approach. And then you get to the majority female employed, and there are several, obviously, here as well, that, again, I won't spend a lot of time going over this, but it's just some data to be aware of when we're doing, you know, our work with schools and our outreach, and how we're looking at promoting people and getting them into pipeline programs. Also wanted to give you some Hispanic Latino data as well. 54% of our residents here in the IE are Latinx. And so we really wanted to give you some data there. And even though we're 54% of the population for Latinx, so for advanced degree, it's only 27% of people in employments have an advanced degree. Have a bachelor's degree, 32%. You know, obviously the closest is the high school diploma, but we're lagging very far behind. You know, we would love to see those numbers being on par that with an advanced degree, that we would have 54% of people with an advanced degree, right? That is our goal. Same thing across all of these, and we're not making those marks in any of these categories yet. Some other ones just to keep in mind, because one of my areas that I always spend a lot of time focusing on in the work that we do and in working with employers. These numbers over here in the dark green on your right are the training gaps, or otherwise just the shortage areas. So we are, in our 5-year openings, in our projections, we will be 182 nurse practitioners short. It's actually probably in excess of that. Pharmacists, 75. Registered nurses, 335 annually, right? So this over a 5-year time, right? These are not like, hey, in 5 years, we need this much. It's that many every year that we're going to be short. So same thing for medical and health service managers that require a bachelor's degree, almost 300 annually. Medical record specialists. So here we are at the associate degree or certificate level. about 42 annually. One that kind of surprised me when we pulled the newest data, because this is the very newest data that's available, massage therapists are something that are going to, that are in shortage right now as well. Medical equipment preparers, and when we're looking at high school preparation. So you do not need any kind of a degree or even a certification for the medical equipment preparers, 122 annually. And then another one that we know that a lot of us love to talk about, especially me, I love talking about community health workers. It does, yes, a high school diploma. The state is still kind of working out the other requirements at this point. There will be a requirement for other certification, but that hasn't come through yet. But annually, 352. This is our biggest shortage area that we have in numbers. So just want to put that on everyone's radar. And then I know that that was a lot of like, and this is bad, and this is bad, and this is bad, right? Sorry about that. But let me tell you about all the amazing things. And I tried to set this slide up to kind of show a progression of middle schoolers on the left to graduating high school seniors that have been in health pathway programs since they were in middle school, many of them. And this is what it really takes, is that investment over time. We are not going to just all of a sudden say, wave a magic wand and we'll have more nurses, we'll have more physicians, right? It takes years of preparation. And like I said, we've been doing this work since 2007. And if we had had the investment in 2007 that is being made today, we would be in a completely different situation. But even the amount we're investing now is still not enough. So keep in mind, these middle schoolers, this is the junior upcoming medical professional program that, is an amazing program that gets people involved from when they're young. And so I'll go through this. Also, just want to highlight the amazing Health Professions Conference just last week that Reach Out put on through Inland Health Professions Consortium at UCR. And we had over 450 high school students from various health pathways throughout the Inland Empire, more than 7,500 health professionals and teachers. It's a full day conference experience for the kids, just like an adult conference with keynotes and breakouts. They leave with huge swag bags from the vendor tables, all kinds of stuff. Just an incredible experience for the kids. And the thing that we love about this the most is they get to be exposed to many, many different careers that they didn't even know existed in health. And the teachers reflected, that this was one of the best years ever, and that the speakers really hit home for all their kids. So that's, one of the things that's happening. The other thing that we're working on is, we know the pandemic was a really difficult time for public health, and we burned out a lot of public health professionals during that time. And really looking at rebuilding our public health workforce here in the Inland Empire. And so last year, we formed, with the help of many partners, the Public Health Leadership Consortium, and it is only open to Inland Empire universities that have public health degrees, our 2 public health departments, and our 2 workforce development departments, and there's a couple of funders sprinkled in there as well. So this work is ongoing. There's an entire strategic plan around this work. Dr. Shermana Davari, who I think is on this call with us right now as well. She is actually over our health workforce work. And she is facilitating this work, and it's been very fruitful. And so just wanted you all to be aware of that. And sorry, my computer just, right? Okay, then I also just wanted to talk about community health workers. Many of our partners that are on today are either using community health workers or training community health workers, like Loma Linda, obviously Reach Out, El Sol, Visión y Compromiso. community health workers are extremely important to our CalAIM efforts and to many other aspects of working towards population level health. And Reach Out, we're really excited. Just about 2 months ago, after 2.5 years of process with the state, just had our Pacific Empire College approved by BPPE. And so we're offering our community health worker trainings now under the college. So we're really excited about that. Finally, I would be remiss if I did not invite you all to the NIC conference, the National Innovative Communities Conference, coming up in June. And we will be having a very intensive health workforce panel and other breakouts around health workforce as well. So we would love to see you all there. And I'll pause there, Allison. I probably used up more than my time. And so I don't know if we have time for any questions or if we just want to move on to our panel. But thank you so much, everyone.
That
Thank-
was amazing, amazing, Diana. And I just want to say that we're going to do questions at the end, and I'm going to let Danielle continue the program now to introduce our panelists.
Yeah, thank you so much, everyone. And again, thank you, Ms. Flock. So please, we appreciate all of the data and the opportunities to partner with you on the journey moving forward to really getting our region where we need to go. So just really appreciate that. So if you do have any questions, please add them in the chat. But wanting to move into the introduction of our legislative panel next. So very excitingly, we have Senator Ochoa Bogh, who represents District 23, and that covers a lot of area, including Banning, Beaumont, Big Bear City and Lake, Cedar Glen, Calamasa, Cherry Valley, Crestline, Homeland, Hemet, Highland, Lake Arrowhead, Loma Linda, Menifee, Mentone, Nuevo, Filan, Pinyon Hills, Rancho Cucamonga, Redlands, San Bernardino, and San Jacinto, Wrightwood, and Yucaipa. The senator has served on many legislative committees, including Education and Health and Human Services, among others. And as a previous teacher, Senator Ochoa Bogh is a champion for stronger schools and education, for economic stability and affordable housing. The senator works tirelessly to champion improved outcomes for everyone in our region and is a deeply valued partner. So please join me in welcoming Senator Ochoa Bogh. Yay! And I will do the other introductions and then turn it over to Allison to facilitate the conversation. So next on our panel, we have Assembly Member Majority Leader Emerita Eloise Gomez Reyes, who represents District 50, covering the communities of Fontana, Rancho Cucamonga, Colton, Loma Linda, Bloomington, Redlands, Ontario, San Bernardino, and Rialto. The Assembly member has served on many committees as well, including Budget, Aging and Long-Term Care, Utilities and Energy, among others. In 2020, Assembly Member Reyes was appointed as the Majority Leader of the California State Assembly, becoming the first Latina and only one of 4 women to hold this position. And as a previous lawyer, the Assembly member is a champion for her community, supporting equity and inclusion for vulnerable and under-resourced communities. So please join me in welcoming Assembly Majority Leader Emeritus Gomez Reyes. And last but certainly not least, we are very excited to welcome Supervisor Karen Spiegel. She represents Riverside County's Board of Supervisors District 2. And this covers the Western Riverside County region, including Canyon Lake, Corona, Eastvale, Jurupa Valley, Lake Elsinore, Norco, and the unincorporated areas of Coronito, El Cerrito, Gavilon Hills, Home Gardens, Lake Matthews, and Lakeland Village, Temescal Valley, Warm Springs, Woodcrest, and others. You all have such a large region that you support. Supervisor Spiegel has been an elected public servant, serving our communities for decades. She has held positions of mayor, city council member, city treasurer of Corona, and was elected to be supervisor in 2018. Supervisor Spiegel also sits on numerous boards and serves Riverside County regionally and statewide, through her various community leadership roles in support of transportation, collaboration, and partnership. The supervisor is a community champion for children and families and a deeply valued partner. So please join me in welcoming Supervisor Spiegel. So I will turn it over back to Allison to guide us through the discussion. Over to you, Allison.
Wonderful. Thanks, Danielle. Great job. And Diana Fox, again, what a wonderful overview. And you and Reach Out have done so much to impact the workforce here in the Inland Empire, including working with us on the White Coat program to train young people to go into the healthcare field and close that gap as the shortage increases. So thank you. Thank you, Diana. Nice job. All right. Here we are with our VIP elected officials panel. We're super excited on this. And I'm going to just launch into these questions here. And I'm going to start with one of you. But as the first person answers the question, if somebody else would like to answer it, you can absolutely do that. Or you can just wait until the next question. So let's start with Assembly Leader, Majority Leader Emerita Reyes. And I'm going to actually jump to question number 2, because I think that's why a lot of people tuned in today to talk about this issue. SB 525 increases the salaries for healthcare workers. In what ways do you see the passing of SB 525 impacting the healthcare workforce in the IE?
Thank you so much for the question, Allison. And I do want to say that I really appreciated the keynote speaker, Diana Fox, and all the details, all the statistics she provided. When we talked about SB 525, the healthcare minimum wage bill, it was clear that it was a very complicated and controversial topic. I heard from both my hospitals, my clinics, and from my workers. So on the one hand, I heard that we had thin margins for our providers, and increasing the cost of wages is going to force them to make some tough decisions because of budget constraints. But one thing that's really important is it's our healthcare workers that allow us to keep our doors open. And I'm really proud as you know, that I supported SB 525, but I was very pleased to be able to take back some of the concerns from those of you who came to see me, take those to the author, so those could be incorporated as much as possible. The bill enacts a multi-tiered increase and puts in place a long-term strategy by adjusting annually for inflation based on the consumer price index, as we all know. But ultimately, I believe SB 525 is a benefit to our healthcare workforce here in the Inland Empire and throughout California. I think that by passing SB 525, having it signed into law, we're ensuring that healthcare jobs are attractive jobs and ones where individuals can afford to live in our community without relying on social safety network resources. I think that when we look at this over the long term, the benefit to our entire system is going to be felt.
Thank you. That was wonderful. Senator Ochoa Bogh, do you have a response or some thoughts on this?
Absolutely. So let me just begin with that the bill is very, very well intended. You know, we want to make sure that people have wages that can facilitate living in today's very high cost of living in our state of California. However, I think the concerns and the reasons why I was not able to support it fully in the legislature, the Senate, when it came before us, was the fact that we have not, as a state, prioritized increasing the reimbursement rates for many of our hospitals, especially for subsidized healthcare in our state. And so the concern lies in the fact that if we're going to, pass this mandate, we're going to have to take on the responsibility to ensure that our hospitals, our healthcare system is fully funded, which in this case, it is not. And so that puts a pressure on our hospitals who are currently having a really hard time staying open. As we know, And I believe it said, I have here, sorry, my watch is thinking I'm talking to it. I have here some facts that I just wanted to share, and I apologize if it's already been stated, but California hospitals lost $8.5 billion in 2022 alone, following a $12 billion in losses during the pandemic. We had a hospital, Madera Hospital, close in 2023. And current estimates state that 20% of the state's hospitals are similarly at risk, while more than half, 52% of California's hospitals have negative operating margins in 2022 as expenses outpace the revenues. So, well-intended bill, but unless the legislature is willing to fully fund our hospitals and our healthcare, it is very difficult for our hospitals to actually stay in business. I spoke to several of my hospitals here in the region, in the Inland Empire, both in Riverside and San Bernardino County. I represent both counties, portions of both counties. And they were stating that, many of them are actually subsidized by their sister hospitals outside of our region or outside of our state. So my biggest concern is that if as a state, we're not fully funding our hospitals, our healthcare system, if we're not, if our current hospitals some of them are being subsidized by their sister hospitals outside of the state, and how can they bear this burden? And I mean burden, not in a bad way towards the merit of the bill, but we're asking them to do this, and then that is going to have a compact impact on the rest of the salaries and for the rest of the faculty in many of these hospitals, because it's going to bump everybody up, which overall increases the cost of the overall hospital. So it's not just the starting, but everybody between there and upward towards the top. And so that is my biggest concern, and why I couldn't, in good faith, vote or support the bill in the legislature, because I knew that we were having a foreseeable deficit in our budget, and as we saw, that was the first thing that the governor said. Wait a minute, we're going to have to put a little hold on this on that end. So optically, it looked great. In merit, it looks fabulous. But unless we take full responsibility and say, here's the money, because in addition to that, I have to say, we also have our hospitals that are dealing with the fact, I don't have to tell you, folks know this, but we also have to deal with the fact that many of our hospitals still have to find the funding to be able to facilitate the infrastructure improvement, the seismic improvements that they have to come up with by 2035. So our hospitals are just bombarded with so many expectations that the legislature has imposed on them, but the legislature has not been responsible in fully funding all of this, including the fact that we have many hospitals that had or borrowed money to get them across to bridge build, and now they're asking for extensions because they don't have the funding to be able to pay those back. So there's a lot of issues happening within our hospitals and our healthcare system that pose a lot of financial strains on them right now, and I'm incredibly concerned about that, especially in light of our current budget deficit. So those are just some of my thoughts that I wanted to put in there, and I'm just explaining some of the concerns that I have on the bigger picture for our healthcare system as a whole.
Thank you so much, Senator. We really appreciate the viewpoint. And finally, Supervisor Spiegel, from the county perspective, you also are approaching this from the big picture. What thoughts do you have on this?
Well, in the whole scheme of things, it kind of goes along with what Senator Ochoa Bogh said, and it's the unintended consequences. That is what's really going to be the challenge. And it's a broad and it's very complicated, as we've heard. The definition of who is going to be included in that class is, to me, so broad that's going to really be devastating to hospitals. The broadness is what is concerning. The fact that including positions that are really outside of healthcare. So to call this healthcare coverage, the positions that are included in this are not direct healthcare positions. And that is one of the concerns. And when we talk about unintended consequences, the concern is beyond just the hospitals themselves. I mean, it is intended for private, but public is just as effective, if not more, because our margins are narrower. Public hospitals, such as our county hospital, has a whole different element, and funding is very complicated in itself. And now we're going to increase this is a mandated increase, but it's unfunded. And once again, we're going to have to figure out how to pay that, as well as the private and everybody else. But one part of the conversation that has yet to be addressed is, I get my insurance statement and my responsibility is this much. And if it's more because they've had to raise rates to cover costs, that becomes more of a obligation on the patient and on the constituent. And so they're going to be having to pay more for their coverage, their health care, because healthcare coverage is, whether you have a 90-10, 80-20, whether you're whatever your plan is, somehow that's going to be paid. And it's going to get down to the constituent that that patient will be paying for the extra costs in the healthcare scheme of things. And that's what I'm talking about, the unintended consequences. Nowhere was that ever intended, because we're trying to increase the wages for the workers, but without looking at every complex element of it, we're going to have those unintended consequences.
Thank you.
Allison, I think that because we have two very varying opinions, I think something that's really important is that as the bill was making its way through, most of the hospitals that came to see me anyway, were sharing that their minimum wage is already very close to what was being proposed by Senator Durazo. And I think that when the unintended consequences, many of those were discussed. We talked about taking out some of our community clinics who, because of the reimbursement rate that the senator was talking about, these were all discussions. And I think I love the conversation we're having now, because it is important to see that whenever a bill is passed, there are good aspects of it, and then there are the consequences that come as a result of that. Providing the wages for our workers is extremely important, and recognizing that now there's a greater burden on our hospitals and clinics is a real concern.
Thank you so much.
Let me just respond to that real quick. The challenge is, yes, so most of the direct healthcare workers, but I'm talking about where the broad paintbrush goes beyond healthcare workers, but those that work at the hospitals or in provider offices that aren't technically healthcare workers. So that's what I'm talking about, the broadness that gives those other challenges of increasing. So the actual healthcare workers, most of them are within that range, and there's not a question. When you broaden the element of those that are working, not direct healthcare, but outside within a healthcare facility, offering different services.
Thank you. And I know that Assembly member, you and the CMA and Senator and some folks were able to work with Ms. Durazo to include some amendments that exempted practices with under 25 physicians or providers, not just staff, but physicians, providers, because that was one of the concerns, that the smaller practices were going in, rural practices were going to be overburdened by this. And so that amendment made a huge difference. So thank you for that. Okay, thank you. That was great. That was a great conversation. All right, so I'm going to skip to, I hope this is okay with everybody. I'm not trying to throw anyone off, but I know people really want to hear the meat of these issues today. So I'm going to skip to what was your alternate guided questions about Prop 1, because that's the other big thing facing us. And as of yesterday, we saw the governor's press conference. It looks like it's been established. The Prop 1 is definitely passed now. Okay. So what priorities and changes would you like to see implemented in the IE with the passing of Prop 1 to ensure continuity of equitable access to mental health services for everyone? And before we do that, let me just read everybody something about Prop 1. Passed by California voters, it will provide the structure and funding for critical early diagnosis and wraparound programs to support children. It will also ensure funding to train and educate more mental health professionals. And it also, I know a big thrust is the emphasis on finding housing for the unhoused. I think the concern with it in large part is that a lot of the local funding is going to be redirected to the state level. And there's some concern about the local nonprofits' ability to continue to thrive in that environment with some of those funds being redirected. So why don't we start with Supervisor Spiegel, since we ended with you last. If you'd like to go first, we'll entertain your responses.
Well, the first thing is, there's two pieces I want to address. And the first one is, just so everybody's aware, Prop 1 did not pass in San Bernardino nor Riverside County. So that's a message to our constituents, don't support this as a whole. And part of that can go back to the mere fact that Riverside County, and I'll probably speak for both counties, are dramatically underfunded. Our health equity is so low. In 58 states, or 58 counties in the state, Riverside County is the 56th funding in behavioral health dollars. That is really something that I have been advocating since I first was elected. I've talked with several of the Congress folks. I've talked to everybody. And, you know, my first class when I was in new supervisor training, I was up there and one of the writers of that original realignment from 1991 basically said, for that to change, we'd have to get the other counties to agree to give us some of their money, because the way the formula is written, it's by county. Well, we are the only county that has doubled since that bill, since 1991. Riverside County has doubled, and we, as you just put in Diane's presentation, talks about how we're going to be the fastest growing, and we are the fastest growing county, fourth largest, both demographically, as far as geographically, and population. And yet we are number 56 in funding. And that is very difficult to be able to reach the needs, but we have been very creative, doing the best we can. We have a challenge with the proposition. I personally was not in favor of any bonds because I think there has not been a track record with the state of being able to be accountable for the monies, but that's my personal. But because I had to see the bigger picture, I was one of the 5 supervisors, and we did support this Prop 1 from our Board of Supervisors because the need is so great in Riverside County. So we did do a resolution to support Prop 1 because we know that we need to meet the needs of those that are in need. And we don't have the ability to have the services that are necessary for as many that we need to reach out to. So it's a double-edged sword for us, but we need to have the support. And so we did take that, you know, without going into a lot more details, those are the top concerns that we have of it. We're hoping that this gets kicked off and that, you know, when you talk about MHSA dollars, that 5% that's going to go back to the state, which means it's 5% less over here, and making sure that we at least cover that 5% in additional monies. So that is a concern, to make sure that the fairness does not continue as inequity with Riverside County and San Bernardino.
Thank you so much. That's great insight. Senator Ochoa Bogh, how would you respond to this about Prop 1?
So, so first of all, I had 2 very similar bills. I had a bill, SB 65 and SB 1298, that I introduced when we had a surplus. The first one, the second I didn't. And basically what it did, it came about, basically it was to expand the mental health bed capacity in the state of California, allocating $1 billion towards that across continuum of need. And the reason I did that is because I do sit in public safety, and I had a very in-depth conversation with our local sheriff in which, concerns in public safety were that we were incarcerating people that should be receiving behavioral health and other types of help rather than being incarcerated. And he says, we don't have the professional capacity to be able to address this. So because of the conversation that we had, we actually introduced this bill with that intent to expand mental health bed capacity in the state. It didn't pass. It passed with unanimous bipartisan support in the Senate, but it was killed in appropriations. I introduced it again with a cap of 3 years, $1 billion each. And because I knew the need. Well, I introduced it in February. The governor came out and said that it was time to expand mental health bed capacity. So I always say, it goes, hey, by the way, it was the Inland Empire senator that brought that to the attention of the legislature and the governor. So I'll take a little bit of credit on that because prior to that, we had not talked about mental health bed capacity expansion. But the governor came out, different scenario. He wanted to do it with a bond measure on that end. But needless to say, at the very end, with Senator Grove, I think we were the only two in our Republican caucus to actually support the measure on the Senate floor, because we truly do believe that the state needs to have strategic funding towards expanding the mental health capacity and everything across continuum of need. So I did support that. However, I wouldn't have done it the way that he did it with the bonds. I would have wanted to see it more from the general fund, and especially since we had a surplus prior to of $100 billion, and we had already spent over $20 billion at the time in homelessness, addressing homelessness in California, without actually addressing the building of the infrastructure. So on that end, one of the things that I would like to see moving forward, if it does fully pass, I mean, we're still kind of hoping that we get that through. One of the components that I think we have as a major concern overall is the fact that we need more levels of accountability if we are to go on that route, in the sense that we've been focusing a lot on the housing first component without a requirement to seek behavioral health or opioid addiction help necessarily. The state overall focuses on housing first. With care courts that we have in place, very supportive of it. I'm gung-ho about that actually, because we had a bill similar to that on that end. Very excited on that component. Very supportive of that as well. But I would like to see overall more accountability and expectations. I'm actually really excited to see and have heard that the city of San Francisco, actually the mayor came out and said that in order to receive a lot of housing and resources for addressing homelessness, there's going to be a condition of accountability of requiring that you seek behavioral health or opioid addiction services on that end, not just housing first. So being that it is one of the most progressive cities and with the huge issue with dealing with homelessness and drug addiction and so forth in that city, I'm hoping that my colleagues will be very receptive to the idea and kind of start incorporating that understanding in moving forward, because thus far what we've done has not been enough. And I don't mean enough as far as funding goes, because we have spent over $23 billion in the state addressing homelessness, yet the numbers, and the issues with behavioral health continue to increase. So it's a big, multifaceted space that I think we need to leverage what we know. And to that fact, that I would like to just end with my colleagues, bipartisan support, submitted a letter to our state auditor to actually study how some of the funding has been spent for addressing homelessness and behavioral health in certain cities, to see what has worked and what hasn't worked, because data is very important in moving policy forward in the legislature. So we have that submitted, and hopefully next year or two we'll see that feedback from that audit to see and guide us more thoroughly as to where we have spent funding correctly and where we need to rethink what we're doing.
Thank you so much, Senator. Assembly Majority Leader Emerita Reyes, what are your thoughts on this?
Well, as we know, it passed by a very slim margin, and as was noted by the supervisor, if it had been up to Riverside, San Bernardino County, it would not have passed. But nonetheless, statewide, even there, it is a slim margin, but it has passed. It did pass. I think we all agree, and I think from what we're talking about, this is a crisis. When we're talking about homelessness and we're talking about mental health issues, we know we have to do something. The senator has introduced legislation, as she's talked about. I've introduced legislation. One thing that recently happened is that the speaker has now formed a new committee. It'll be a standing committee on oversight and accountability. We find that we are spending money on a particular issue. We're told it's being used for exactly what it's supposed to be used for, but we need to do more oversight. We need to do, there has to be more accountability. And we had our first hearing, and it was on homelessness and mental health. And I was very pleased about that. We also reviewed the auditor's report regarding some of the failings. We talked to the Department of Housing, Community Development about the programs that we are funding and what it is we can do to make those programs better, to find out which of the programs are providing the best help so that we can replicate those. And for me, same thing. I always say, tell me what you're doing specifically in the Inland Empire. If you're talking about making sure that we're working on homelessness and mental health, tell me what you're doing in the Inland Empire, because the more you provide to my community, the more supportive I'm going to be. In the last point in time count here for the County of San Bernardino, there was a 25% increase in both the sheltered and unsheltered individuals that are experiencing homelessness. We have to be very concerned about that. And the general budget, especially now, we did have a time of lots of money. And during that time, I'm proud to say that I was able to bring in $2 million for one of our shelters, but that's just not enough. There had to be a bond. I know that this is going to cause even more problems for us in the future because of the amount of money that's going to be spent. For every $1 billion in a bond, that means $83 million has to be spent each year on our budget. But the issue is clear, we have to address it. I did hear from our local nonprofits, our community groups that are working in this area, and they are concerned. They're concerned that they're already doing some of this mental health work, and that some of the money is going to be refocused for housing as opposed to mental health. That's a real concern, and we've got to figure out how we repurpose ourselves, reinvent ourselves so that we can provide all of these services, because our local groups are doing so much with so little, and we need to make sure that we provide the support to them. The changes that I think are going to come. I think, as was mentioned, and I think you talked about that at the very beginning, Allison, it's both for mental health and all of the wraparound services and the housing. But the housing is, there's greater emphasis on our veterans, greater emphasis on our youth, and that is a serious issue. And I think the other thing with the groups that I have worked with that came to see me or called me or sent emails regarding the issue is that I want to be sure that our local groups and our counties start to get ready, start to put the plans together so that when the money starts to roll out, they are ready with programs. That's really important. The other is that if if we're going to be recasting some of this funding, one thing we can do is say it's wrong, we shouldn't do it. And although I may agree with some of that sentiment, I think that what I tell my organizations is we should see this as an opportunity to do whatever it is that needs to be done to integrate the services. And that includes health, job training, front door service, whatever it is that we can do to provide the services that are called for under the bond. We deserve to have as much of the funding as possible come to our community. And I think that there's more that we can probably do to get ourselves ready to receive that money. The other thing is I want to see more forums like this. I think this is absolutely necessary to be able to have, and then to have for my colleague in the Senate and also from the supervisor, even though we see issues with this, we recognize that this is probably this is our future, and we've got to see how we bring the money here to our community to serve those in our community. These forums, stakeholder group discussions, or any other organizations that get together to discuss this, I want to be part of this. I want to be able to bring in our experts from Sacramento to provide input to make us better and more successful in receiving our fair share of the money that's going to be part of this bond.
Thank you so much. I think all of you have certainly reflected what the assembly member is saying as well, and that is the Inland Empire often does require, it has its own personality and its own needs, and it requires special consideration. And so one formula for the state does not fit every county. Thank you. Thank you all so much. All right, let's jump to what was the first. Yes, sorry.
The
Go
senator
ahead.
and myself both want to respond.
Yeah, sorry, there are your hands up, sorry.
Oh, we thought you were applauding.
Yeah, yeah, that's right.
I really admire the words that you said, some member, majority leader. I really like when you said be prepared. And a lot of the transportation funding, we have to have shelf-ready projects in order to get the funding. And I see that as a possibility in if you can take that back in discussion, because we've been working on a whole wellness village, and it's the whole wraparound services with.
I want you to know that's one of my favorite. I always talk about it.
Yes.
It's such a great success program.
Well, we now need the funding to build the rest of the campus. And so we've been working on it. We are starting in hopes of the funding. We had just had it on our agenda this past week to get the preliminary, it takes forever to build, but it's not the construction that takes forever. It's the process. And so we are beginning that process. As I said, it was on our agenda this past week. We have two major projects that we want to do. They're both almost shelf ready. And so I like the idea of the overwatch on the monies. I know that we could do better as a state with the monies that we get. And I feel that we do diligent in our counties. But if there was some type of an overwatch program that we have to be accountable to the money coming to us, rather than just handing us money. And I think that's where the challenge comes in, that it's frustrating for those of us that are very cautious of our spending to watch other money being given out that's not being used properly. And if there's more oversight, I know it's harder, and my county may not like when I say this, but that would give us the opportunity to all work harder and to be accountable for money that I don't want to say given, but that is used for a purpose that's going to have the benefit that we're all looking for.
Yes. I
Wonderful.
agree.
Senator, you had some comments as well.
Yeah, there's one other area that I would like to just bring to your attention, and I think something that we have to be very cognizant about. One of the things that I saw during the pandemic when I first was elected was, as we were addressing the issues of construction for our homeless or unhoused constituents. I'm really concerned with the fact that when you break down the per unit for instance, in Sacramento, they had a CalNeters article in which it posed the fact that it costs between $400,000 and $700,000 per unit to remodel a hotel in Sacramento to house our unhoused population. And so we need to look at why that is the case and ensure that it doesn't cost so much to refurbish or to build or to remodel. What are the costs of the project and how many units are being built per cost and why? Because in my opinion, $400,000 to $700,000 anywhere for a little studio is an enormous amount of money that I don't think was very well managed or spent. When we can go literally now on Amazon, it's might been brought up to my attention, you can buy a tiny home for $15,000. How many people can we house with a $15,000 mini home, a tiny home in a village with wraparound services? So that is one of the concerns that I want to start looking or asking people, everyone, Californians, to look at why, as we allocate this funding, why is it costing that much? Because we could house so many more individuals if we were being more considerate as to our construction cost.
May I just say that in the oversight committee, that was I asked the question, I said, tell me exactly how much it costs for each unit. And the numbers varied. And then we had a brown bag lunch with the director. And I said, why was that question such a difficult question? And I may not explain it as well as he would, but it isn't just the building of it. It is all of the services, the cost of all the services that come afterwards and for years to come. But my question, and I think we need to get you on our oversight committee too. So we can both ask the questions. My question to him then was, can you break it down? Tell me how much it actually costs to build it. Because if we're saying something in the Bay Area is going to cost $1 million, I'm sorry, I don't want to spend $1 million per unit. I recognize land is very expensive there, but come invest it in San Bernardino County. Our land is cheaper, and but that question and that is so important. How much are we spending per unit? But I don't have an answer, but I can tell you I asked the same question. Must be an IE thing.
Well, we're fortunate that you are asking, all of you are asking those questions, because I think a lot of times that financial oversight is, someone has to kind of delve into the fine print on this stuff. And that's it right there. And a lot of times, the devil is in the details. So that's really important that we're glad you are all thinking about that on behalf of the rest of us. Thank you. All right. We don't have a lot of questions in the chat. So let's take time to ask one more question, and if you can each just take it maybe a couple of minutes to answer this, if you'd like. It was the first guided question you received, and that is, what do you see as the major challenges to securing an adequate healthcare workforce in the IE over the next 5 years, and how might our region be equipped to respond? And you've covered a lot of that in the context of your responses on these other issues, but do you have any overall ideas in addition to what you've already explained? Why don't we go ahead and start with, let's start with the senator.
Thank you. And yes, I think we've touched upon some of the concerns, previously, but obviously our population growth, right? That's going to pose a challenge for us to be able to build that workforce. Aging population, the rising of cost of living, the workforce burnout, and the education and training pipeline. I think some of the issues that are really impacting the healthcare workforce. But in order to address all of that, I think as a legislature, I sit on education. I love my committee. I think we need to we've been focusing on ensuring that if there's anything that we can do to either streamline the educational pathways to healthcare is something that we need to reassess and see without jeopardizing the quality of training. See how we can do that. We need to allocate funding to grant programs, incentives for healthcare workforce to be able to stay in the area. But when I say that, I want to say that that's just the Band-Aid, because the reality lies in the fact that as a legislature, we have to focus on reducing the cost of living as a whole, because it won't matter what we pay people. It won't matter how much funding we allocate towards programs if the cost of living and doing business in the state of California continues to rise exponentially. We'll never catch up. We'll be literally a cat chasing our tail round and round and round, because those are just Band-Aids. Overall, we have to reduce the cost of living so people are incentivized to stay in the area, can afford to stay in the area with what we're paying them, or the funding that we're allocating towards education. We have to expand collaborative opportunities whenever possible. It's very, very important that we do that. We have to embrace technology, maximize what we can maximize when it comes to telehealth and technology as a whole, to either facilitate education, to facilitate services being rendered in the Inland Empire. And all of that, by the way, we've been very supportive on those measures to see how we can, one, bring that pipeline of healthcare workforce hearts, because it's a heart, right? People who work in healthcare, they have to have a heart for people and service. Sorry, I get emotional because we're seeing such a burnt out workforce because there's such a shortage. And the culture that we have has a tendency to foster very self-serving interest, and not many have that heart to give and to serve, which is what we see and need in healthcare. And I see that as a challenge, a cultural challenge in our society. So we have to foster events and values being promoted that actually incentivize and plant seeds in our youth that want to have that heart. Let's see. But I think those are probably the biggest things in my focus that I've been either supporting or speaking to as we deal with our healthcare shortages in the IE. I hope I answered your question. I think I might have gotten a little sidetracked here.
No, I think it was great. And, you know, these questions are really just launching points for all of you anyway, to talk about what you do, how you do assess the broader situation. So this is perfect. Thank you. Assemblymember Reyes, what are your thoughts on the challenges to the workforce issues?
First, I've got to give shout out to our local institutions of higher education that are providing so much. And when Diana was talking about the statistics about what we need, just as the senator was talking about, these are the jobs of the future. We know they're going to be paid well, and we need to send more of our students there. One area that for me, I mean, I was looking at the list of our local places: Loma Linda University, California University of Science and Medicine in Colton, Western University, San Bernardino Valley College, RCC, CSUSB, UCR, West Coast University, Chaffey Colleges, IE Healthcare Institutes. I'm sure there are many others. Our students, we can send our students to attend these schools. And as the senator said, we need more grants for them, especially if they're fulfilling a need in an area that has, in a disadvantaged area, which is our area. Another thing is what Diana talked about, the Health Professions Conference at UCR with 450 high school students. I mean, you're already setting them up. This pipeline is so important, and it's so commendable to take those students now so that they know, even though they don't have anybody in their family who is a doctor, a nurse, or anybody in the health related fields, they know that these are doors that are open for them. and that this is something they can choose as their profession. Now, I'd be remiss if I didn't talk about the fact that we have an aging population. And we need to make sure that if in 2030, we're expecting that 1/4 of our population is going to be seniors. I know there's another term for us, but I can't think of it. Then we have to make sure that we're training the future also to take care of the aging population. All of these are great opportunities, quite frankly, in making sure that the funding is provided for our students, and there are lots of programs. I will, if I may, I'll brag a little bit that I did include, there was a bill that I had introduced, and my language was taken out and put in as a budget trailer bill, which was signed by the governor. It provides for $10.8 million, and this is for graduate degrees related to mental health. Very specifically for mental health. So if somebody already has a bachelor's degree in anything, but wants a graduate degree in a mental health related field, they can apply for up to $25,000 a year. And so long as they spend 2 years after they graduated in a disadvantaged community providing services, all of that will be waived. They never have to pay it back. And these are the opportunities that we know we have to find them. The money is still there. They're trying to claw back some of it. And we know the senator and I keep hearing all of these stories about clawing back some of the money that they had already put in. But we need to find all of those opportunities for our students so that it makes it easier for them to enter all of our health fields. Thanks.
Those are great points. Thank you. And Supervisor Spiegel, we'll give you the last word on this topic.
Well, and we're almost out of time here. We're ending. The Inland Empire is one of the fastest growing regions. I've already said that. That's wonderful, but with that comes some challenges. We are the lowest per capita healthcare workers in the state. That is scary. So we are lower than anybody else in the state. So we already have an issue. We've recognized it, and I'm sure with San Bernardino, but I can only tell you with Riverside County, we're focusing on that. It has to be. There are a couple of things that we need to look at, and one is when we get these residencies, like all the colleges that the Assembly member named, are wonderful, but it's the residencies that we have to look at. When they go off to do their residency, if they are leaving our county, chances are they won't come back to practice. Mm-hmm. We need to have enticements. We need to make sure that we get them to stay in the county. And IHP, and Luann is on the call, so I'm glad somebody from IHP. I sit on the board. And one of the things we did, we have a foundation now, and we are working with our medical students, and we have scholarships. And the scholarships will be erased. They're scholarships in a way that if they stay in the county, they're erased. So we fund them very significant amounts to put them through school. And if they do 5 years of their residency in Riverside and San Bernardino counties, that'll be erased. Now, if we can start finding more of those enticements to keep our students in the county after they become full-fledged doctors, or whatever their program is, then I think that would be critical. When you look at 2033 and the number of doctors, I mean, we had the numbers that were up earlier, how many are retiring, that was even discussed. That's really scary. So at the same time of getting our residency of those that are in college or going in college, we also need to look at starting our pipeline younger, going in those STEAM classes and STEM classes, and make sure we get the students to start thinking that direction, because it's a lifelong career. You don't start that, when you're in college saying, oh, I want to change. Very rarely do they stick to it when they change, because it's such a significant amount of time. So when you look at all these things that we could do, but they're preparatory, we have to do them ahead of time. You can't just suddenly say, let's get people become doctors. they have to be in the pipeline at all different levels to keep that pipeline flowing as the retirements come in. And so we need to be creative, we need to be proactive. And I think if you take all three of our ideas, we're going to be successful. So it's getting everybody on the same page, working the same direction. And I'm really excited that, three minds are thinking the same way, that the resiliency of Riverside County and San Bernardino County is critically important.
Well, that was amazing. Thank you so very, very much. And yes, you're all in alignment on a lot of that. And I want to mention on the IEHP Scholars Program, you're right, it's an incredible program. And 6 of those scholars are accompanying us with the San Bernardino County Medical Society to our annual legislative day, where we'll be visiting at least 2 of you up in Sacramento. Our appointment's already confirmed. Thank you. So it's a chance for those students to accompany our additional 12 students that we take with us. But yeah, that's really key. And of course, the Prop 56 funds that passed in 2016 through the tobacco tax and the upcoming MCO tax ballot proposition up on the November ballot, that will enable millions and millions, actually I think billions more in graduate medical education, GME funding to keep those students. And of course, the CMA is leading the coalition on that. So those are all in alignment with what you're saying, that if we can keep those residents practicing in the IE, then we're going to be closing that healthcare gap. And we're back full circle to where we started with Diana. So I want to thank you all again so much. I'm so sorry we're out of time. We only have 1 or 2 questions. So I think if we can, we'll have to address those next time. Diana did put some wonderful additional material and comments into the chat. So I would encourage you really quickly to click on those, including information about our upcoming public health workforce report being generated by Reach Out, their NIC flyer, and Slingshot Health data. So thank you again so much to our speakers, Diana Fox, CEO of Reach Out. That was amazing information today. And we're just so honored to have had Supervisor Karen Spiegel from the 2nd District of Riverside County, State Senator Rosilicie Ochoa Bogh, of course, representing the IE, and Assembly Majority Leader Emerita Eloise Reyes, who is such a wonderful supporter as well. Your information was terrific, and we're just so fortunate to have you all representing us and just have such passion in what you do. So thanks for making a difference, and thanks for making our world better, not just in the IE, but in the state and well beyond. So we will have this forum recorded, and we will send that to each of you. It will also be available on the IECHI Facebook page by later today or Monday. And don't forget to like our Facebook page so you can get all that information, and we can tag you in our posts. And we will be having a quarterly health education forum coming up in a few weeks. We'll be notifying you on that. So thank you to all of you for joining us today, and we wish you wonderful holidays coming up. Thank you again. We'll see you very soon.
We do a quick photo, please?
Yeah. Oh, yeah. Let's do a photo. Okay, everybody, smile for Prince.
There we
Get it?
go. Yeah, 1, 2, 3. Perfect.
Awesome. Did you get it?
Yes, I did. Thank you so much.
Great. Will you send that to me, Prince?
Absolutely.
Thank you so much. All right, everybody. Bye. Thank you. Have a good weekend.